Hi everyone, I hope everybody's doing well. Today our topic is prescribing penicillins for acute pharyngitis. Pharyngitis is basically infection of the throat. It could be viral, bacterial, or fungal. In acute pharyngitis, the reason why we want to treat this is because we want to treat streptococcal throat infections with penicillin such as amoxicillin. And the reason why we want to treat strep throat infection is because if it is left untreated, it can lead to acute symptoms as well as chronic or long-term effects. And the most devastating effects are actually the long-term effects because they can lead to joint issues like arthritis as well as heart valve damage. And this is one of the most important causes for heart valve damage, such as mitral stenosis and aortic stenosis, which requires valve replacement later on in their life. Okay, so what happens in this setting is that a person comes with pharyngitis and the throat looks reddish. They have swollen tonsils, and the physician decides to treat this as strep throat with amoxicillin. Within a week of this treatment, the patient comes back and they have a rash that looks something like this. This is called a maculopapular rash. It appears on the trunk, meaning the back, the chest area, the abdomen area, as well as arms and legs. It spares palms and soles. Also appears on the face as well. And what happens with this, why this is significant, is because this tells you that the infection that was treated as strep throat is actually a Epstein-Barr virus infection. So now this infection at this point is called infectious mononucleosis. And this is important to diagnose because amoxicillin is not the treatment of choice for these patients. Okay. Other features that would present with infectious mononucleosis besides the rash would be fever. Fever would be high grade from 103 to 104 degrees Fahrenheit, enlarged tonsils with purulent discharge, meaning pus coming out of the tonsils. Lymphadenopathy would be majorly located in the neck area, so cervical lymph nodes, the anterior nodes as well as the posterior nodes. Spleen would be enlarged, meaning there would be splenomegaly. Elevated WBCs or white blood cell count, particularly lymphocytes, because this is a viral infection. If you take this person's blood and do a peripheral smear, then you would see atypical cells. These are T cells, particularly the cytotoxic T cells, which are CD8 positive cells, and the monospot test would be positive for this. Okay. For cases of infectious mononucleosis, there is no specific treatment. So what you want to do is you want to counsel the patient and tell them to discontinue the amoxicillin that they were prescribed initially, and the rash usually disappears within 3 weeks. Most of the symptoms also disappear on their own. Usually steroids are given to reduce the swelling of the tissues, such as throat swelling. So if there is enlarged tonsils, it's usually hard for them to eat or breathe. So you want to give steroids sometimes if the swelling is too much. And the spleen, if it's too enlarged, can also cause issues, particularly in those people who are involved in contact sports, because if the spleen gets damaged or there's trauma to abdomen, it can lead to splenic rupture and complications later on. Other than this, it's just supportive therapy for this Epstein-Barr virus infection, usually just for fever. You would give painkillers and you would give antipyretic medication. That's it for this topic today. Thank you for listening. Please subscribe to this channel. I hope you liked this video. Goodbye.